We're talking about the body being a self-healing organism. Why doesn't it heal? That's what chiropractic discovered. We discovered, our forefathers discovered, why the body doesn't heal. Can you imagine knowing that? How secure can you possibly be as a healer, as a professional person? How secure are you when you're working on the lesion or working on the lesions that will, when corrected, that entity will begin a new process, and that new process will produce homeostasis. Homeostasis, maintained over a period of time, will induce healing. The induction of healing over a long period of time, the body heals. Wouldn't that be a magnificent thing that everybody in the entire world would have chiropractic, would have this procedure done? Wouldn't that be the ideal? That all these sick people, the enormous cost of health care, all the inefficiencies of the world, the retardations of the world, we know, we work with at the fundamental root, the basic cause we call it, of all disharmony, not diseases. Disease we refer to it as. Our work, your training, your education is focalized and crystallized on your understanding of that philosophy. Your services in chiropractic is predicated upon your knowledge of knowing where to locate an offending vertebrae in the spinal column that would prevent the full expression of life in that person, that prevents healing, that prevents the person from utilizing their full potential. B.J. used to say, we'll empty the hospitals, tear down the jails, open the mental institutions, and fill up the churches. No wonder the preachers was mad at us, and one of the medical doctors was mad at us, and one of the institutions and the hospital administrators were mad at the chiropractors. Because if what we say works, what we say works, and we can demonstrate it, how long do you think the medical doctors would be in business? Not knocking drugs, not criticizing necessary surgery, not criticizing needed medical care when it's all necessary. Basic, fundamental issues. Now, the thing you've got to figure out in your own mind, to your own satisfaction, why is this so? I can tell you because I was an astute student, Dr. Umber mentioned. I didn't figure it out for 2 years, so you don't mean to say you got it after I talked today. You got it after the first week of the first quarter. You probably won't get it for at least a year, maybe 2 years, maybe be 10 years in practice. You'll finally come to realize it. I couldn't figure it out. I wanted to be a great doctor. I was a midline student at Georgia Tech. I was a 2.5, I guess it was. That's like being over here at Southern Tech, that's like a 3.5 over there, or Notre Dame, that's like a 3.8 up there. University of Georgia is like a 4.0 if you do a 2.5 at Georgia. That's how we think about the Bulldogs. Tennessee, Mississippi, Florida, heck, you can go down there and never even go to school. At least we have to graduate. You follow? Or you got to come to grips with this right here, and I want to ask you this simple question. All of you are going to get this. Some of you are sleeping in here, trying to sleep. Some of you are yawning, looking up in the air. I want you to quit that. If I drop this key, what happens? Young lady, what happens if I drop it? You don't know what happens if I drop this key? It's a real simple thing. This is the basic understanding of chiropractic. Is the law of gravity a natural law? Do we have to pray for it? Induce it in any way? Will it work in spite of us? Not because of us? Is it operative in everything that we do? Do we take that in consideration? There's a law inside of people. We call it an innate intelligence inside of every being. That comes from somewhere. There's probably a lot of innate all over us out here. I think we've magnified this spiritual ideal. I think there's an innate just everywhere. We're in a sea of spirit out here. Can you imagine touching the source, understanding about life, understanding about who we are and what we are, understand how we function from a new perspective? We say that health, life, comes from within the patient. It's generated in the brain. It's a mysterious thing up here. It's a part of the eternal. We say that innate intelligence is just as smart as universal intelligence. Can you imagine God being in this room? I don't know whether you ever thought about where God is. You think God's up in the heaven, up here behind one of these clouds? Maybe behind the sun. No God right here in this room? Is God a man like me? Or is he like Paul? Like our Egyptian brothers over here? Like our Israeli brothers? Or is God spirit? Is God everywhere? Is just as much God here as in Mars, South Africa, Ireland, Sweden? We say that same spirit which we call innate intelligence resides in the brain, that has the wisdom to run this entire organism, run all the systems, create all the tissue cells, run all the organisms, adapt, be in control of every situation. We say also that there's an interference to that system, created primarily by vertebral subluxation. This is the thing your forefather discovered. He looked in the text. He kept palpating these people. He found bumps and distortions in vertebrae that wouldn't move. Looked in the text, no mention. Medical texts say vertebrae can't move. Vertebrae can't become fixated. Nerves can't become irritated. If you do move the vertebrae, the patient dies. It's an impossible procedure. He kept palpating. He was a magnetic healer. He laid his hands on people. Some people would improve. Some people would not improve. He kept asking himself, why are these people sick? Why, when I lay my hands on some of these people, I can elicit some kind of sensation from them? Some improve. What's preventing that life from expressing itself? He discovered the vertebral subluxation and its impact and coined all the verbiage that we use today. Lost its juxtaposition. The misalignment, out of alignment with the one above or below, to the extent that it's less than the luxation, to where it impinges and interferes with the nervous system. That's what we correct, is vertebral subluxation. Well, long story short, if I drop the keys, don't they fall? Well, if you make the correct adjustment, the correct diagnosis, and everything else being normal, there's no threatening pathological crisis in the organism right now of a ruptured artery or vertebrae or a heart blockage or something like that. If I drop that key, that's all you do in chiropractic. That's all any chiropractor's ever done. That's your reason for being. The successful practitioners that you've known about, all of these years, are the ones who can do that job most effectively. Your dependence upon the innate wisdom inside of the patient and your professional ability to select those patients that have this lesion is what's made chiropractic great. Is what will make chiropractic great 100 years from now and what will make you successful. Learn how to select the cases that have vertebral subluxation, that are correctable in your clinic. Make sure the patient doesn't need referral at that time to another health care provider. That's all there is to it. You got to pass your national board. You got to pass the coursework at Life College with a 2.25. You got to pass your state boards. And if you follow our advice over these years, you'll be an ultra successful person. Ultra successful. Because this works. If you make the right adjustment, whatever that patient's suffering with, they begin to heal. They begin the reversal process. That's what I mentioned to you earlier. If we could take you in 30 days, give you the technology, develop the skills, do the diagnostic procedures for you, and put you in the field out here making the right adjustment, you would not have to have a dialogue with the patient. Because they get well anyhow. Because they're self-healing. If you make the right adjustment.